I currently work at Denver Health, and as this is a safety net hospital, many of our clientele are those who are part of the vulnerable population, including uninsured or the homeless. The case study that I'm presenting is about homelessness in healthcare. I chose this case study because in my time working with these patients, I noticed that they tend to struggle with healthcare access, the ability to maintain health, and discrimination, especially those who are deemed frequent flyers, visiting the hospital and emergency department frequently. Nursing leaders really have a large influence on that, and can help facilitate change in the work environment and within the healthcare system. So this case study follows a 36-year-old man named John. He doesn't present as a stereotypical homeless person. For most of his life, he lived financially stable, with a family, including a wife and kids, and lived in a stable home. He was on the way to receive a job promotion. However, things took a turn when he lost his job due to a mass layoff within his company. This also led him to lose his income and file for unemployment. He began to have feelings of psychological distress, feelings of anger and depression, as despite vigorous efforts to find a new job, there were no opportunities for him. He began to cope with alcohol. During an alcohol binge, he got in an altercation with his wife. This altercation turned physical, and she proceeded to leave him, and she took her children with her. Now, with little source of income, only the unemployment checks, he was left unable to pay for his mortgage. He was then evicted, and this led him to have to start couch surfing and living with friends and family. One day he became sick with a sinus infection. He was prescribed antibiotics in the emergency department. However, he couldn't afford to pick up this prescription. Soon after, his drinking and emotional well-being worsened, and consequences of these actions included being unable to find anyone to let him sleep at their homes, and he was then forced to sleep in parks. After a night of drinking, John fell, and this left him with a cut on his leg. It quickly progressed to symptomatic cellulitis and required him to visit the emergency department again. He was then prescribed antibiotics, which again, he was unable to pay for the full prescription and only was able to receive half. And then following this incident, while sleeping in the park, he was jumped and robbed by a group of teenagers. 911 was contacted by a bystander, and he was transported to the emergency department. Once again, he began to have many frequent visits in and out of the emergency department, and each time he was not screened for homelessness, and he had orders for discharge home, as the healthcare staff was not aware he was being discharged to the park. Later in his time of homelessness, he was introduced to an outreach program team. They showed him services for one of their local clinics for health care for the homeless. He began utilizing this resource and was successful in treatments as they provided him addiction and behavioral health services. They also matched him with a case manager that was working with him to find housing. So in this case study, we can really see how in the beginning, he had a difficult time finding healthcare that accommodated his financial needs, and this impacted his mental and physical well-being and health and further worsened his situation. A large responsibility for nursing leaders is education for staff, and ensuring that they are providing high-quality care for the patients and providing the appropriate resources for each individual. So one way that nursing leaders can ensure this is being taken care of is through completing appropriate admission screenings and understanding the importance of those screenings. This can be achieved through chart reviews, training modules, organizing workshops for staff, And although John did not present as your typical homeless individual, his needs were overlooked because of this, and the correct screenings were not performed. Therefore, he was left not getting the appropriate care he needed. Having this necessary information would have prompted healthcare providers to connect him with a case manager that could have helped him get Medicaid, housing, and connect him to programs to help his recovery. There are many resources out there that serve homeless individuals, and one of them is the PATH program. This is supported by the Substance Abuse and Mental Health Service Administration. This program helps facilitate screening and diagnostic treatments, habilitation, rehabilitation, community mental health programs. They have an outreach team. They help with substance use disorders and help give referrals for primary health care, job training, educational services, and housing. So this similarly reflects the clinic that John was introduced to at the end of this case study. And these programs really do help improve health outcomes for patients and decrease readmission rates, as we saw that John had frequent readmissions and was not able to adhere to treatment appropriately due to his financial status.